as them as a modality. They're very.
Hi everyone. So it's been really so many days, and I was not doing in the live study session, and actually I was not studying consistently also. But खुद को बहुत ज़्यादा समझाने के बाद आई जस्ट रियलाइज कि नहीं यार पढ़ना तो पड़ेगा ही. नीट पीजी की टेंटेटिव डेट्स आ चुके हैं. दे आर अबाउट 15th June. एंड am I visible? ओके तो अभी हम ज़्यादा टाइम वेस्ट नहीं करते हैं बातें करने में. इन द नेक्स्ट स्टडी सेशन आई बी शेयरिंग लॉट ऑफ इन्फॉर्मेशन. एंड अभी हम कर रहे हैं पढ़ाई. लास्ट टाइम आई डिड दिस स्टडी सेशन तभी भी आई वॉज डूइंग द प्रोटोजोआ, एंड अभी भी मैं यही कर रही हूँ बिकॉज उसके बीच में मैंने सब्जेक्ट स्विच कर लिया था. आई वॉज स्टार्टिंग मेडिसिन, वो भी मैंने रेगुलर नहीं पढ़ी. सो अभी हम पढ़ रहे हैं प्रोटोजोआ. एंड आई थिंक 1 घंटे का टाइम है अभी मेरे पास, तो ये वीडियो कंप्लीट हो जाएगी because I have to do micro completely by watching the videos, and I'm left with 2 more videos of this. उसके बाद I will do reading of this subject.
Famously show you the twitching motility. The twitching motility, also known as the jerky motility, you say that now first I will always look at something under a microscope. So there's a female. She's come to me with a greenish color discharge and a strawberry cervix, and when I look at it under the microscope, which is the form do you think that I'm seeing over here? Of course, propozoid. Only propozoid form can exist. And now tell me that how many nuclei do you see? I see one nucleus. How many flagella do you see? 1, 2, 3, 4. I see 4 anterior flagella going, of course anterior, and then I see one flagella going all the way back like this. So there is one posterior flagella, and why is it going as a zigzag? That zigzag thing is known as an undulating membrane. This zigzag thing that you are forming over here, this is referred to as the undulating membrane, the zigzag appearance. So now total kitna flagella hua? 4 are going towards the front, 1 is going towards the back. So 4 plus 1 makes it 5 flagella. So difference pata lag raha hai. See, Giardia lamblia was a man. How many eyes? 2 eyes. How many nuclei did he have? 2 nuclei. How many nuclei did this have? Only 1. Giardia had how many flagella? 4 pairs, 8 flagella. This has 4 plus 1. That is 5 flagella. So have a look at this. This is also pear shaped, but nucleus, single nucleus. Here पर भी pear shaped, but everywhere you will see only one nucleus inside it. That is the trichomonas vaginalis. So now comes the story of this fashionable auntie. See, fashionable auntie, she is gonna love the fruits. Which fruit? She loves exotic fruits like strawberry. So coming to this, she loves exotic fruit like strawberry. So what is the cervix, guys? Strawberry cervix. And strawberry people green होता है तो trichomonas का discharge का color, it is going to be a greenish color discharge that the female.
Hi people, so I'm preparing for NEET PG 2025. Am I audible? So I'm doing my internship, and अभी के लिए my postings are in emergency department. So by 9 I have to reach to the hospital, and before that I'm just studying pathology from Dr. P.T. Sharma ma'am, and this is just a live study session of almost 50 minutes. और या उसके आगे मैं लेट हो जाऊँगी हॉस्पिटल पहुँचने के लिए. सो इतना ही टाइम है हमारे पास में, सो इसे फटाफट से फिनिश कर लेते हैं. एंड पास्ट फ्यू डेज आई वॉज नॉट रेगुलर, and very soon I'll be uploading a vlog also, like one today or tomorrow. So please do watch that vlog related to my postings. And okay, so let's start this. And there is a feature in iPad and iPhones which is background sounds. You can go and on that in your settings, and वहाँ से I have on this fire वाला sound, जिसकी वजह से I'm able to focus. And let's start this session. And yeah, whatever you will comment, if I am watching the screen, only then I'll be able to see कि हाँ क्या comment आया है. Otherwise we don't get any notification कि हाँ किसी ने कुछ comment किया है. So please do not think कि मैं आप लोगों को ignore कर रही हूँ if you do any of comment for now. So let's start this session again, and I'll be replying to all of your comments after like 30 minutes. So let's do this. And my target is to do protozoans part 1. So let's do this.
We will have. Next, why am I calling her fashionable? Because look at her hairstyle. She's got a fringe cut. Again, she's got 4 flagella. Okay, she's got 4 anterior flagella. She's got a fringe cut, and then she has a one long ponytail at the back. As a zigzag, one long ponytail at the back. So one posterior flagella. Also, because she got hair in the front, उसका एक आंख छुप गया. So how many eyes does she have? So ma'am, her hairstyle is that her eye has only one eye is visible. There is only one nucleus that you see. Also, she's so fashionable, ma'am. She has put eyelashes. She has put fake eyelashes. So what is the culture media? It is the lash cysteine hydrolysate serum. Lash media है. दूसरा media कौन सा? She's fashionable. She loves diamonds. So दूसरा media is going to be the diamond media. That is your entire story of a fashionable auntie, which covers everything that you studied over here, from the strawberry cervix to the greenish discharge to the eyelashes wala lash media, diamond media, her 4 anterior flagella, 1 posterior flagella, everything is done. What is the treatment? Again, metronidazole, but it's a male female STD treat both the partners. I hope these stories are okay for you. The angry old man, Dadaji of the duodenum, and now we have the fashionable auntie. Because now we are going to switch the family and go on to the next. These are known as the Hemoflagellates. Let's begin with the next part, that is the Hemoflagellate, and this includes the Leishmania as well as Trypanosoma. Before I begin with them, you should be familiar with what are the forms and the types that are going to be there, which is famously learned as the mnemonic paper. What is APET, amastigot, promastigot, epimastigot, and trypomastigot. So all of them you can see they have a flagella coming out, hence I call them Hemoflagellates, right? But which is the one where the flagella does not come out? So A for amastigot, and that is not going to have a flagella, so A for absent flagella. How is the flagella coming out? I see one structure over here. What is the N for? N is going to be the nucleus, and this P and B, P for parabasal body, B for blepharoplast. एक साथ what are you going to call them? You're going to call them the kinetoplast. So there's one nucleus and there's a kinetoplast. How is the flagella coming out? So all of them you can see they have a trypanosoma. Before I begin with old man, Dadaji of the duodenum, and now we have the fashionable auntie. Because now we are going to switch the family and go on to the next. These are known as the Hemoflagellates. Let's begin with the next part, and that is the Hemoflagellate, and this includes the Leishmania as well as Trypanosoma. Before I begin with them, you should be familiar with what are the forms and the types that are going to be there, which is famously learnt as the mnemonic APET. What is APET? Amastigot, promastigot, epimastigot, and trypomastigot. So all of them you can see they have a flagella coming out, hence I call them Hemoflagellates, right? But which is the one where the flagella does not come out? So A for amastigot, and that is not going to have a flagella, so A for absent flagella. How is the flagella coming out? I see one structure over here. What is the N for? N is going to be the nucleus. And this P and B, P for parabasal body, B for blepharoplast. Ek saath, what are you going to call them? You're going to call them the kinetoplast. So there's one nucleus and there's a kinetoplast. And from the kinetoplast everywhere, the flagella is coming out. So please note, in all these forms, the kinetoplast is in front of the nucleus. Kinetoplast is going to come in front. Where is the kinetoplast going to be? Behind the nucleus. So I see over here that in this situation, the kinetoplast is post-nuclear, and that's the question that you... Next, why am I calling this? I hope these stories are okay for you. The angry old man, Dadaji of the duodenum, and now we have the fashionable auntie. Because now we are going to switch the family and go on to the next. These are known as the Hemoflagellates. Let's begin with the next part, and that is the Hemoflagellate, and this includes the Leishmania as well as Trypanosoma. Before I begin with them, you should be familiar with what are the forms and the types that are going to be there, which is famously learned as the mnemonic paper. What is APET, amastigot, promastigot, epimastigot, and trypomastigot. So all of them you can see they have a flagella coming out, hence I call them Hemoflagellates, right? But which is the one where the flagella does not come out? So A for amastigot, and that is not going to have a flagella, so A for absent flagella. How is the flagella coming out? I see one structure over here. What is the N for? N is going to be the nucleus, and this P and B, P for parabasal body, B for blepharoplast. Ek saath, what are you going to call them? You're going to call them the kinetoplast. So there's one nucleus and there's a kinetoplast, and from the kinetoplast everywhere, the flagella is coming out. So please note, in all these forms, the kinetoplast is in front of the nucleus. Kinetoplast is going to come in front. Where is the kinetoplast going to be? Behind the nucleus. So I see over here that in this situation, the kinetoplast is post-nuclear, and that's the question that you get, especially important for INI CET students. Now let's go forward and see that out of Leishmania and Trypanosoma, who shows which of these forms. So there is a bet that I'm telling you. Cats are very frisk animals, isn't it? So I'm giving you a bet that you cannot keep the cat on your lap. The cat is going to run away. So I'm giving a bet. What does that bet mean? B stands for Trypanosoma brucei, C stands for Trypanosoma cruzi, and L stands for Leishmania. And now the forms are in front of me. Bet means brucei has epimastigot and trypomastigot. Cat, amastigot, trypomastigot, epimastigot, and cruzi. And lap, Leishmania has amastigot and promastigot. So simple. Bet that you cannot keep the cat on the lap. Out of them, I am now going to tell you that each one of them is an insect. Bug hoga, fly hoga, everywhere there will be an insect, and which is the form that is only seen in insects, not seen in humans. So that is going to be the epimastigot form. So how I have learned it is, aaj se yaad rakho E insect, and that is going to be epimastigot. Okay, so E insect is going to be epimastigot form. Now let's go forward. Which insect am I talking about? So that is going to be mastigot form. So how I have learned it is, आज से याद रखो E insect and that is going to be EP mastigot. ठीक है, तो E insect is going to be EP mastigot form. Now let's go forward. Which insect am I talking about? So when you say Trypanosoma cruzi, cruise, living the life in the cruise, मतलब a super duper life. And that will remind you one couple in dialogue jhakas. So remember, cruise में जाना मतलब jhakas like, that is going to be Chagas disease. And Trypanosoma will remind you of the bug, and that is going to be the triatomine ready-made bug. Next we talk about Trypanosoma brucei. Brucei is going to cause SNS, that is going to be sleeping sickness, and this is of many types. There is a West African sleeping sickness, East African sleeping sickness, मतलब all Africa वाला countries, and S is going to be for CC fly. CC fly for sleeping sickness. अब all this was Africa, so where is the America वाला? So this is the American, the South American sleeping sickness, then becomes the Chagas disease. Coming to the last one, that is Leishmania. I don't even want to mention, we all know it, causes Kala Azar, and the vector is going to be sandfly. Do you want to see the life cycles? Vectors हो गया, forms हो गया. If you've learned bet you can't keep the cat on the lap, if you've learned the vectors, let me take you to the life cycle. As soon as you will see triatomine reduced bug, you say, oh, Trypanosoma cruzi, मतलब bet you can't keep the cat. Cat में ma'am Trypanosoma cruzi will have A mastigot, Trypomastigot, EP mastigot, out of which is the form that you see only in the insect. EP mastigot will only be seen in the insect. So remember, the form that comes to us is Trypomastigot, changes to A mastigot, changes back to Trypomastigot. That is taken by the insect again. So Trypomastigot is taken, form that you see only in the insect. EP mastigot will only be seen in the insect. So remember, the form that comes to us is Trypomastigot, changes to A mastigot, changes back to Trypomastigot. That is taken by the insect again. So Trypomastigot is taken, EP mastigot is formed, and then once again it's going to form a Trypomastigot. So if I ask you, what is the form that is going to enter us and leave us? So man, Trypanosoma cruzi में Trypomastigot enters, Trypomastigot leaves. तो इधर humans में चलेगा and then insect में चलेगा tet cycle is going to go on, and you will always know EP mastigot will happen in the insect only. Next one we come to is Trypanosoma brucei. Bet means you are going to have epimastigot and Trypomastigot. तो humans में कौन सा form होगा? Trypomastigot. Insect में कौन सा होगा? Epimastigot and Trypomastigot, both are going to be seen. And which fly were there? This was the seed fly for brucei. Bet means you are going to have epimastigot and Trypomastigot. तो humans में कौन सा form होगा? Trypomastigot. Insect में कौन सा होगा? Epimastigot and Trypomastigot, both are going to be seen. And which fly were there? This was the seed fly. A CC fly मतलब sleeping sickness. I know it is the case of brucei. Coming to the last one, what is Leishmania? Bet you can't keep the cat on the lap, ma'am. There are only two forms of insect and human का कुछ नहीं है. A mastigot and promastigot are seen in insects also. A mastigot and promastigot are seen in humans also. I identified it by the sandfly because the sandfly is definitely something that is seen in Leishmania, Kala Azar. So your three life cycles are sorted. Now I'm going to go on to the diseases one by one. I'm first starting with Trypanosoma cruzi. it in the case of Lucy. Coming to the last one, what is Leishmania? Bet you can't keep the cat on the lap. There are insect and human का कुछ नहीं है. Amastigot and promastigot are seen in insects also. Amastigot and promastigot are seen in humans also. I identified it by the sandfly because the sandfly is definitely something that is seen in Leishmania kala azar. So your 3 life cycles are sorted. Now I'm going to go on to the diseases one by one. I'm first starting with Trypanosoma cruzi. Cruise life, best life, Chagas life. So Chagas disease, triatomine, radioid bug known as American sleeping sickness is of 2 types. Acute Chagas disease, chronic Chagas disease. Acute Chagas disease shows you this sign that is in front of you. The Romana sign. What do you see in this female? There is a peri-orbital edema. There is a peri-orbital edema that you notice in this female. Now over here, when it goes into a chronic state, firstly, cardiac involvement. These patients are going to have myocarditis. Secondly, all the organs in the GIT are going to become mega. If I say what happens to the esophagus, you will say mega esophagus. To the colon, you will say mega colon, right? What sample will I take? I can either take a blood sample or I can take a Buffy coat sample from these people. Blood sample or Buffy coat sample. So before culture, if you took a blood sample, what did you see over here? There are some C shape, and let me see if you've been listening to me carefully. Flagellated organism hai ma'am, and this big wala dot must be the nucleus. But behind the nucleus, I see a dot called the kinetoplast, and from there I can see a flagella is coming out. Post-nuclear kinetoplast. Nucleus के पीछे है kinetoplast हर जगह. That means this is going to be which form? This is the Trypanosoma form that you are seeing over here. Lastly, what culture are you going to do? We do the triple N culture media over here, and what is the treatment? It is done by benzimidazole. Benzimidazole is the treatment. Otherwise, you have to give supportive symptomatic treatment also. So now I've got a story for all of you, which is a story of a very, very rich American couple. Firstly, what is the concept of calling them American? Because I am talking about something known as American sleeping sickness as of now. Okay? Now, why am I calling them rich? Because they have decided that we are going to travel by a cruise and we are going to go all the way to Rome, Italy. Rome is our cruise. Say we are going to travel over here. So cruise is going to tell you what cruise shall tell you that they are going to be Trypanosoma cruzi ka baat ho raha hai, right? And where are they traveling? They are traveling all the way to Rome. So what is the sign going to be? We are talking about the Romana sign, the peri-orbital edema. And if someone is going to the cruise is rich, of course. He's going to the cruise not in public transport. He's going to go by Mercedes, Merc. What is the Merc Benz going to tell you? The treatment is going to be benzimidazole. The treatment is going to be benzimidazole. Finally, I say that I have said that of course they are living the best life. They are leading the Chagas life. So that is going to be the Chagas disease. And of course they are going for their honeymoon. Honeymoon means that if they're going to be myocarditis, means if their cardiac involvement, yes, there is a honeymoon. That is why they're going on a cruise. They're going to Rome and all of that. And of course, so rich man, you will say, "Ma'am, favorite Indian dialogue, bade log, badi baatein." Because everything is going to be huge. There is going to be mega esophagus. There is going to be mega colon, and that is the entire story. A rich American couple traveling by Mercedes Benz, benzimidazole, going in a cruise, cruisy disease, going to Rome, Romana sign, leading the Chagas life, Chagas disease. They are on a honeymoon, so myocarditis, bade log, badi baatein, mega esophagus and colon. That's the beautiful story. But now I want to ask you, what are all the parasites that cause myocarditis? How are we going to learn it? I am saying, what are all the parasites which cause myocarditis? Myocarditis करने के लिए you have lots of T and E. Means I've just taught you the famous Trypanosoma cruzi, है ना? अभी पढ़ा Trypanosoma cruzi. In a while I will even teach you Trypanosoma brucei. Apart from that, later on the nematodes we will do Trichinella. Then we have something known as Toxoplasma, which is the next chapter. And also sometimes we can have Echinococcus or the dog tapeworm that can cause it. So all the T's that you study along with Echinococcus, that is going to cause myocarditis. The Chagas disease is done. Now we go on to Trypanosoma brucei. Brucei means that I'm talking about sleeping sickness, and sleeping sickness means that the vector is going to be the tsetse fly. Please note that one of them is West African and one is East African. So for that you will have to learn a mnemonic that the sunrise is going to happen in the east and the sunset matlab game over. That is going to happen in the west. So sunrise is going to happen in the east, which means that rise, rhodesians, is going to be East African sleeping sickness. Sunrise, rhodesians, East African. Whereas game over, ma'am, sunset, game over is going to happen in the west. Which of them can happen in humans and animals and both? So remember, East African में A आता है, तो animals में किस में होगा? Animal involvement will happen in East African sleeping sickness, whereas rest is only to do with humans. So East African में there is going to be animal involvement. Next, which of them, the most important question, which of them shows you the winter bottom sign? Firstly, what is winter bottom sign? Winter bottom sign means there's a lot of lymphadenopathy that is present. So W for W, winter bottom sign will be seen in West African sleeping sickness. Which of them is going to be more parasitemic, more virulent, more resistant, difficult to treat? Sir, the difficulties are by East African, because when someone is rising is the real struggle, isn't it? It is the real struggle. You are more ferocious, you are more aggressive, you are wanting to put in that extra work. That is what this rising Indonesians is doing. It is more parasitemic, more virulent, more resistant. That means that for treating Gambians, so I can use pentamidine, but for treating Rhodesians, I will need something called pseudomine, which will be more effective against put in that extra work. More parasitemic, more virulent bottom sign. Firstly, what is winter bottom sign? Winter bottom sign means there's a lot of lymphadenopathy that is present. So W for W, winter bottom sign will be seen in West African sleeping sickness. Which of them is going to be more parasitemic, more virulent, more resistant, difficult to treat? Sir, the difficulties are by East African, because when someone is rising is the real struggle, isn't it? It is the real struggle. You are more ferocious, you are more aggressive, you are wanting to put in that extra work. That is what this rising Indonesians is doing. It is more parasitemic, more virulent, more resistant. That means that for treating Gambians, so I can use pentamidine, but for treating Rhodesians, I will need something called pseudomine, which will be more effective against East African sleeping sickness. Sorted with this as well. With the treatment in one table, we are done. I hope no other confusion. Most expected question: winter bottom sign is seen in West African sleeping sickness. Coming to the last one, Leishmania. Let me take a test. Come on, guys. What was the vector? The vector was sandfly. What disease am I talking about? Of course, we are talking about Kala Azar. And Kala Azar, basically, why did we call it Kala? Because there is a blackish discoloration or a pigmentation that occurs in the skin. And you can also see a protuberant belly because these kids are going to have hepatosplenomegaly. Now, there are two forms. Remember, lap means amastigot and promastigot. So, remember the diagnostic form is got blackish discoloration or a pigmentation that occurs in the skin. And you can also see a protuberant belly because these kids are going to have hepatosplenomegaly. Now, there are two forms. Remember, lap means amastigot and promastigot. So, remember the diagnostic form is going to be amastigot. That is how do the diagnosis. That is what you see as LD bodies. You see LD bodies, na? LD bodies are nothing but amastigot. Whereas the infected form is going to be promastigot. So pro is like pro. It is the one that is going to cause infection. Amastigot is for diagnosis. So now let me come to the diagnosis. The most sensitive area to take a sample from is the spleen. Puncture the spleen, you will see the LD bodies. But spleen is very vascular. There are a lot of risks present. Bleeding का risk है, puncture का risk है, lot of risk. So what is going to be the more preferred site is going to be bone marrow and blood. And in HIV people, bronchoalveolar lavage can also be done. So once you have punctured any of these, what are you actually going to see under the microscope? You will say, ma'am, you just told us that the diagnostic form is the amastigot form, which means the Leishmania LD bodies. And till now you have told us that the organism can also be done. Vascular, there are a lot of risks present. Bleeding ka risk hai, puncture ka risk hai, lot of risk. So what is going to be the more preferred site is going to be bone marrow and blood. And in HIV people, bronchoalveolar lavage can also be done. So once you have punctured any of these, what are you actually going to see under the microscope? You will say, ma'am, you just told us that the diagnostic form is the amastigot form, which means the Leishmania LD bodies. And till now you have told us that the organism is not going to be just the nucleus. Organism में सिर्फ nucleus नहीं है. Nucleus के साथ there is a छोटा dot, kinetoplast. Every LD body will not only have a nucleus, it will also have a kinetoplast. So in short, you will say, ma'am, one big dot and one small dot. So if I zoom in, firstly, I can see a huge cell over here, and that cell is nothing but a macrophage. And I notice that all the organisms have a big dot and a small dot, big dot and small dot, big dot and small dot. Yes. Now it becomes so easy to pick up. If you look at the other picture also, everywhere there is big dot, small dot. So these are all the LD bodies that you're talking about: big dot and small dot, nucleus and kinetoplast. Fine. Then you will ask me that because it's a parasitic infection, is there going to be an increase in the immunoglobulins? Yes. There is aldehyde and antimony test for immunoglobulin. No one does it now, honestly. It's only for your FCPs. Napier's aldehyde and Chopla's antimony test is used over here. What is the media? The media once again is the triple N media, but on the media what you see is the promastigot form. So now you are going to make a small little table and tell me that triple N media को कहाँ use करा था? Triple N media was used for Trypanosoma cruzi and now it is being used for Leishmania, right? These are the two organisms on which you are using triple N media. So what you see under microscope is amastigot, but what you see on triple N media is promastigot. What is the famous antigen test? RK39. RK39 antigen card testing is done for Leishmania. PCR is of course the most definitive. Kala Azar ka treatment has been asked in the paper. Liposomal amphotericin B. So this bच्चे का picture was given with a belly and a kala, blackish discoloration. Liposomal amphotericin B. So you gain liposomal amphotericin B for 1 to 2 years, and after that what happened? So 1 to 2 years after treatment, sometimes the patient will land up with these kind of hypopigmentations, and these hypopigmented nodules will be post Kala Azar, and skin पर है तो dermal. Post Kala Azar dermal leishmaniasis after 1 to 2 years after treatment shows you hypopigmented nodules, and the treatment is going to be multifaceted. So remember, if they ask you the treatment of Leishmania, Kala Azar, it is liposomal amphotericin B, but for post Kala Azar dermal leishmaniasis, it is multifaceted. Let us do some very quick, fancy now. This is a question that again came in NEET 2023. What is going to be Leishmania tropica that it is causing? So Leishmania tropica causes something called the Delhi boil or the oriental sore or the Aleppo button. All these fancy names were given. Delhi boil, Aleppo button or oriental sore, and that is going to be Leishmania tropica. What does Leishmania brasiliensis cause? It causes mucocutaneous leishmaniasis, also known as espundi. Espundi is something that is caused by brasiliensis. Last one, Leishmania recidivans. Recidivans means something is receding, something is kind of decreasing, kind of increasing, कुछ recede हो रहा है. Means this occurs due to inadequate treatment. So this is how the patient is going to look like. The central area is clear, but there are lesions which are present around the central healed area. So the central area is basically healed, but around that central healed area, you will see lesions like this. That is known as Leishmania recidivans, which is caused because of inadequate treatment. That definitely wraps up all of your Hemoflagellate, Leishmania, and Trypanosoma, which means we can now take up the next family, and the next one is the Coccidian parasites. Let's begin with the next family, and these are the Coccidian parasites. Now, this includes Toxoplasma gondii, that is going to be one separate organism, and the other three are going to be Cryptosporidium, Cyclospora, Isospora, which is one diarrhea wala family. And in the end, you hardly get any questions.
Hi everyone. So I'm from GMC Bardware and मेरी internship भी यहीं चल रही है from the GMCH hospital. And the chapter is I'm studying parasitology now, and मेरी माइक्रो के अंदर just 3 videos are left and I have to do all these विदिन 2 to 3 days बिकॉज मैं साथ साथ मेडिसिन भी कर रही हूँ. एंड आई वॉज इन अ फैमिली फंक्शन बिकॉज ऑफ विच आई वॉज नॉट वेरी कंसिस्टेंट. एंड उसके बाद आने के बाद घर से माई स्टडी वॉज रियली, मतलब ऐसा हो गया था कि पढ़ाई हो ही नहीं रही है. ओके, सो स्टार्ट दिस अगेन. नहीं, द पीपल हु आर सेइंग कि लाइव करके क्या दिखाना चाहती हो कि मैं पढ़ती हूँ, नहीं ऐसा नहीं है यार. अगर मैं पढ़ाई नहीं कर रही होती ना लाइव स्टडी सेशन, तो अभी मैं बैठ करके इंस्टा खोल के और रील्स देख रही होती. सो आई डो नॉट वांट दैट. दैट्स व्हाई आई एम स्टडिंग, सो दैट कोई देख रहा हो चाहे नहीं देख रहा हो, कहीं ना कहीं फीलिंग होती है दैट पीपल आर वॉचिंग यू. सो आप पढ़ाई ही करनी है, इधर उधर नहीं भाग सकते. सो दिस इज़ वाई. एंड इसके अलावा आई कैन स्टडी फॉर लॉन्गर पीरियड्स. अदरवाइज़ मैं 15 मिनट के अंदर सोचती कि चलो चलो छोड़ो, बोर हो गए पढ़ते पढ़ते, अब कुछ और काम कर लेते हैं.
called Sarcocystis. These are all the Coccidian parasites. So first we'll start with Toxoplasma gondii, and please note this has a definitive host in the form of a cat, which is the most important. So this is the cat wala, cute little cat wala life cycle. And then the humans, actually if you realize the humans are getting infected as an intermediate host. So this is what you have as a human. This has a definitive host in the form of a cat, which is the most one diarrhea wala family. And in the end, parasites. Let's begin with the next family, and these are the Coccidian parasites. Now, this includes Toxoplasma gondii, that is going to be one separate organism, and the other three are going to be Cryptosporidium, Cyclospora, Isospora, which is one diarrhea wala family. And in the end, you hardly get any question in something called Sarcocystis. These are all the Coccidian parasites. So first, we'll start with Toxoplasma gondii, and please note this has a definitive host in the form of a cat, which is the most important. So this is the cat wala, cute little cat wala life cycle. And then the humans, actually, if you realize the humans are getting infected as an intermediate host. So this is what you have as a human. So definitive host is cat. What are the definitive hosts? In which the sexual reproduction takes place. So that is what you have. So now, what are the forms which are going to come to us? So you will say that there are three forms: sporulated oocyst, or a bradyzoid, or a tachyzoid. And all the three forms can come to us in some form or the other. So remember, what the cat passes in her feces. So imagine we are having to read about cat feces also. So when the cat passes something in the feces, that is going to contaminate the food and water, and this contaminated food and water is then going to reach us. So sporulated oocyst is something that comes via contaminated food and water. On the other hand, if we end up eating, because there's a life cycle happening amongst animals also, if we end up eating any undercooked meat, so what is going to come? It is going to be the bradyzoids. मतलब टिश्यू में कौन सा फॉर्म होता है? टिश्यू में होता है bradyzoids. However, if the same thing comes to us via blood transfusion, then what shall come to us is the tachyzoids. How am I going to learn it? See, पहले तो learn the sporulated oocyst. This you can learn. Sporulated oocyst is going to come via contaminated soil and food and water. So now if they say unsporulated oocyst, so please note what the cat actually passes. I'll write this once again. What the cat actually passes in the feces is unsporulated oocyst, and then it takes some time in the environment to form a sporulated oocyst, and that is what is going to come to us. So if they ask you, is the fresh cat feces infective? No, the fresh one is not infective. It takes a few days for that sporulation to occur in the environment, and then it comes to us. After that, you have to make sure you do BT-BT. BT मतलब कि अगर blood transfusion पूछा है, will you write bradyzoids? No, ma'am, I have to make a combination of BT-BT. So if blood transfusion is asked, I will mark tachyzoids. And if tissue is asked, like some meat or anything is asked, then I will mark bradyzoids. So bradyzoids is with tissue, and tachyzoids is with blood transfusion. BT-BT का combination. So what is Toxoplasma gondii going to be? So also another thing that I just told you, mother to child torch infection, of course. So congenital toxoplasmosis is a big problem, and you know the most severe infections occur when they travel in the one. But the maximum chances of transfer from mother to child is going to be trimester 3. And what is that 3C and 2M that we study? So this is what you study in Toxoplasma: chorioretinitis, cerebral calcification, and because of that there are convulsions. There's microcephaly and also mental retardation. I hope you remember this from your main lecture, that Toxoplasma, because it's the same चीजें लिखा है ना. All of these are also seen in cytomegalovirus happening in the child. Cytomegalovirus happening in a congenital infection shows you exactly that. But Toxoplasma shows you what calcification? Cerebral calcification. Whereas your cytomegalovirus has the vena, so it shows you the in the brain only, but it's part of the brain. It is periventricular calcification that you're going to see in cytomegalovirus. यहाँ पर in the cerebrum you see. That is what you have to differentiate. So which one shows you periventricular calcification? Cytomegalovirus. This is where it happens mother to child. When it happens in an adult who is fit and fine and immunocompetent, अगर immunity is good enough, I'll put a tick mark, immunity is good enough, so most of them can fight it off. It is going to be an asymptomatic infection. If at all something has to happen, maybe some lymph node will be enlarged, and that's about it. But when it involves an immunodeficient person like HIV, तो brain involvement होता है. And they ask you what happens with the brain? Encephalitis. And what is going to be the most common part affected? It is the brain stem which is most commonly affected. That is the question that you get. So of course, the next question coming to your mind is how do I do the diagnosis? What is the gold standard, guys? The gold standard for the diagnosis is going to be identifying the antibodies using the Sabin-Feldman test. It is a kind of a test which uses what? Which uses methylene blue. So I don't want you to learn the full, the full procedure of this, but please note that at the end of the test, if you don't get a color, if there is no color, colorless, this means, or I will just write colorless, if the color is not obtained, this means the antibodies were present. Opposite chal raha hai, because if color of methylene blue does not come, this means the antibodies were present, and if the color comes up, this means the antibodies were not there. The test is a little lengthy, of course you can refer to the main video for the full 5-minute description of it, but the end result is this, or opposite hoga, color aaya to no antibodies, color nahi aaya to antibodies are there. However, now we have much more advanced testing. So first tell me, if IgM comes out, what will you say, ma'am? This is a recent infection, everywhere IgM acute infection. If IgG comes out, but there are two IgG you have to figure out over here. If it is a low avidity IgG, then also still it is an acute infection, because initially the IgG that is formed is low avidity. Only when the IgG starts forming to be of strong avidity, that is when we say that this has gone into a long-term and a chronic infection. Okay, so now on that note, what is the treatment? The last point, it is pyrimethamine with sulfadiazine is given as a treatment for toxoplasma, which you read in pharma, and this family is done. Now in the same Coccidian parasites, I come to Cryptosporidium, Cyclospora, Isospora. Why are they one family altogether? Because they cause diarrhea in what people? In immunocompromised people. You will always get an HIV positive person with diarrhea. That is very important for you to know. Now please note, out of these, I will first teach you what are the differences between them in terms of their sporozoids and sporocysts, and then I take you to the life cycle and the differences. So please note that for every diagnostic notice, I have written it in an alphabet. Alphabetical order. Cryptosporidium, Cyclospora, Isospora. Alphabetical mein likha. Now tell me how many sporozoids does it have to begin with? Cryptosporidium has 4 sporozoids. Fine. Next, how many sporozoids does this have? Cyclospora usually this also has 4, but cycle की तरह है. Cycle की तरह मतलब 2 are going to be आगे, 2 are going to be पीछे. There are 2 tires of a cycle. Cyclospora has 2 cycles वाला tire. So it has 1 tire over here, 1 tire over here, and 2 are split in each. Isospora is even bigger. This also has 2, but it has 4 plus 4 sporozoids. Means it has a total of 8 sporozoids. So if you just have to make a number game, you will say 4, 4, and 8. 4 sporozoids. Then Cyclospora also 4 sporozoids, but split into 2 plus 2. And Isospora is 8 sporozoids split into 4 plus 4. Is that okay? Because now I can teach you that what is going to be the most important table that you have to know out here. Look at this, guys. Cryptosporidium, Cyclospora, Isospora. Again written in an alphabetical order. If I ask you what is the size of the cyst going to be, it is 4 to 6 microns in case of Cryptosporidium. Double kar do, it is 4 ka double is going to be 8, 6 ka double 12. So Cyclospora is 8 to 12 microns, and 12 ka double triple 24 to 36 microns is going to be Isospora. Okay? So alphabetical order and keep on doubling. What is the shape? Look at their alphabets. Their alphabets will tell you the shape. Cryptosporidium, Cyclospora, Isospora. Cryptosporidium complete the what do you get a round shape. Cryptosporidium is also round. Cyclospora is also round, and Isospora can look like this. So this is going to be an oval shape. Which of them are acid fast? All of them are going to be acid fast. Cryptosporidium complete the 36 microns is going to be Isospora. Okay? So alphabetical order and keep on doubling. What is the shape? Look at their alphabets. Their alphabets will tell you the shape. Cryptosporidium, Cyclospora, Isospora. Cryptosporidium complete the what do you get a round shape. Cryptosporidium is also round. Cyclospora is also round, and Isospora can look like this. So this is going to be an oval shape. Which of them are acid fast? All of them are going to be acid fast. But Cyclospora cycle की तरह है ना. Cycle I always told you cycle. So sometimes it is acid fast, sometimes cyclical, sometimes it is acid fast, sometimes it is not acid fast. So they ask you which of them is variable acid fast. That is Cyclospora. Who is going to shine on its own? Autofluorescence. The Spora brothers. The Spora brothers are going to shine on their own. What is going to be the treatment? Of course, you remember it is acid fast. Sometimes it can look like this. So this is going to be an oval shape. Which of them are acid fast? All of them are going to be acid fast. But Cyclospora cycle की तरह है ना. Cycle I always told you cycle. So sometimes it is acid fast, sometimes cyclical, sometimes it is acid fast, sometimes it is not acid fast. So they ask you which of them is variable acid fast. That is Cyclospora. Who is going to shine on its own? Autofluorescence. The Spora brothers. The Spora brothers are going to shine on their own. What is going to be the treatment? Of course, you remember from the main, the main story that I taught you in the main videos. The Spora brothers are treated with cotrimoxazole. But what do you treat with nitazoxanide? So I have told you Nita Ambani ke paas cryptocurrency. Lot of money, of course. Nita Ambani has a lot of money. So Nita Ambani, that is nitazoxanide, is going to have Cryptosporidium or cryptocurrency, and that is the treatment for Cryptosporidium. Whatever I have taught you, I want all of you to look at it under this. So firstly, you say that ma'am, the easiest to pick up is this oval wala, because Isospora is going to have that shape. Isospora is going to have that oval wala shape, right? These are the round ones. So one of them is Cryptosporidium, one of them is Cyclospora. See, all of them are acid fast. All of them are acid fast. Whereas over here, this is acid fast, and this is totally white. It is not acid fast. It's cyclical show kar raha hai. That is going to be Cyclospora. Sometimes it is acid fast, sometimes it is not acid fast. So variable acid fast. Whereas Cryptosporidium, the first one that we have, that is going to be acid fast. for sure, right? Now, what are the last two questions which are important? One is from microbiology. Which of them can be associated with eating of raspberries? So remember, cycle के आगे वो जो एक there is a basket ना in front of every cycle. So उस पे what are you going to put? You are going to put some raspberries. So cycle पे raspberry लेने गया. This is because of raspberry consumption. This is because of raspberry consumption. So remember, cyclospora has everything to do with cycle. Like a cycle, it has two sporozoids आगे, two पीछे, right? Like a cycle, sometimes it is acid fast, sometimes it is not. And on that cycle, I have kept a bunch of raspberries because this is because of raspberry. This is because of raspberry consumption. The next and the last question that you have is with regard to Cryptosporidium, and that is a question that you get in pathology a lot. So now, what is the question that you get in pathology over here? I hope all of you remember this image which came in the previous arranged paper. I have taught you this in the pathology lectures also. This is a case of Cryptosporidium because the problem is, or you can say the differentiating point is, that Cryptosporidium is a little different from the others. First point of Cryptosporidium is that it can cause auto-infection, right? It can cause auto-infection. We can infect our own cells as and when by being infected, we can infect ourselves. And secondly, when it goes on to the intestine, it doesn't go inside the intestine. Cryptosporidium is that it can cause auto-infection, right? It can cause auto-infection. We can infect our own cells as and when by being infected, we can infect ourselves. And secondly, when it goes on to the intestine, it doesn't go inside the intestine. It gets attached to the brush border of the intestine. So it's like a crypto, it's a cryptocurrency, like I was telling you. Crypto means something that is hiding. So it decided that I'm not going to go inside the cell, no. I am going to make a tunnel and hide over here. I'm going to make a tunnel and hide along the brush border. I will not go inside the cell at all. I will hide in a tunnel, and that is going to be by the formation. What is that tunnel that it is formed? By a tunnel known as parasitic porous vacuole. So this Cryptosporidium has made a full cryptocurrency. Crypto means hidden. So first remember, this is the one that is hiding in a vacuole called parasitic porous vacuole. Another question of crypto that you have to know is that Nitambani means crypto, so Nita Roxanide is the treatment. And this third mnemonic in this entire thing for cyclospora that you have to know is that cycle की तरह होगा सब कुछ, and you're going to carry raspberries on a cycle, so that is why raspberry consumption. So that marks the end of the entire Coccidian parasite. What do we move on to next? We now move on to the next one, and that is going to be the hematozoa. So you know hematozoa includes what? Malaria and Babesia, right? Of course, malaria is the one that requires more of my attention. Babesia is just for 5 minutes. So what is it about malaria? What are the different kinds of malaria that you have to know? We have something called malaria vivax, falciparum, malariae, and ovale. Everyone remember these 4 malaria that you have? जो छोटा वाला नाम है. When I say vivax, it's a छोटा वाला नाम, and when I say ovale, these are 5 alphabet things, छोटा छोटा. So they have the छोटा वाला word, and that is relapse. Relapse is seen with vivax and ovale. And where do you see this lengthy name called recrudescence? So you will say, man, falciparum is a long name, and Plasmodium malariae is also a long name. That means the lengthy names are going to show me the lengthy recrudescence. So you will now ask me the difference between these two. What is relapse? Relapse is the activation of hypnozoites. So whatever malaria came into my body, and in my body it went and got hypnotized. Hypnotized means because it blank हो गया, started hiding in the liver. Now when they get reactivated, reactivation of the hypnozoites, that is going to result in a relapse. Whereas what is recrudescence? Recrudescence means inadequate treatment. Inadequate treatment or incomplete treatment is given as a result of which that there is a recrudescence or a reappearance of the disease that has happened, or the disease has gone on for a longer time. That's the difference between the two. So remember, chota wala naam is for the chota wala organism, and the lengthier name is going to be for the lengthier organism. So if you didn't understand what are these hypnozoites, let me quickly tell you the life cycle. Guys, who is the definitive host? We know it's the female Anopheles mosquito. The female Anopheles mosquito is going to be the definitive host. Who is the intermediate host? Of course, us. And now I know female Anopheles mosquito is going to be the definitive host. This means the sporocytic cycle, the sporogonio, the sporocytic cycle, or you can just say sexual reproduction will happen there. Definitive host may the sexual reproduction, male, female, gametocytes, and all of that usually going to happen. Whereas in humans, we are the intermediate host. So what happens in us? How do we get it? As we said, the female Anopheles mosquito is going to bite us. And what are we going to get from the saliva of the female Anopheles mosquito? We get the sporozoites. The sporozoites in the saliva are going to, in humans, we are the intermediate. This means the sporocytic cycle, the sporogonio, the sporocytic cycle, or you can just say sexual reproduction will happen there. Definitive host may the sexual reproduction, male, female, gametocytes, and all of that usually going to happen. Whereas in humans, we are the intermediate host. So what happens in us? How do we get it? As we said, the female Anopheles mosquito is going to bite us. And what are we going to get from the saliva of the female Anopheles mosquito? We get the sporozoites. The sporozoites in the saliva are going to come, and which part of our body do they go and infect? Guys, we all know it. They are going to go into the liver. That's the first part they go into, and in the liver, then they start developing. They make something called schizont. After making a schizont, the schizont is going to like this, a balloon ki tarah, the schizont is going to rupture. So where are they all going to go now? Liver will die, they developed a little, and then balloon burst. Now, which is the next organ that they will go to? Now they are going to go, and their journey will continue in a red blood cell. So how does malaria, for example, if this is a red blood cell, how is the malaria organism going to come and attach to it? So kaun sa malaria hai na? Have you got Plasmodium vivax or have you got Plasmodium falciparum? These are the two main ones. Because if you got Plasmodium vivax, in my blood there is something called ductal antigen which is going to receive it, and if you got Plasmodium falciparum, then in my blood there is something called basogen which is going to receive it. So now what is going to receive it will depend on what malaria has come into my body. Vivax has come, so ductal antigen will receive it, and falciparum has come, so basogen will receive it. Once we have received it, once the red blood cell has received it, TSG banta hai. TSG is a tumor suppressor gene. TSG is first thing formed as a trophozoite. From a trophozoite ट्रोफोजोइड फॉर्म नेक्स्ट इज अ शाइजोन. तो या तो ये ट्रोफोजोइड शाइजोन का साइकिल चलता है, और द ट्रोफोजोइड इज नाउ गोना फॉर्म गेमेटोसाइट. सो लाइक आई सेड देयर इज TSG. ट्रोफोजोइड इज फॉर्म, शाइजोन इज फॉर्म, गेमेटोसाइट इज फॉर्म. एंड फाइनली व्हाट इज द फॉर्म? मेल फीमेल गेमेटोसाइट which the mosquito is going to take back. So which is the form that is infective to the mosquito? The gametocyte is going to go. And please note there have to be at least 12 gametocytes that are present per microliter of blood meal that can make the infective. So how many of the gametocytes should at least take up? It should take up at least 12 gametocytes per microliter, male female gametocytes. So now if I ask you a question, what is the form which is going to be infective to man? So simple, what is the form that is going to come to us? तो हमारे पास जो saliva से आएगा sporozoid will come to me. And what is the form that will go from me away to the mosquito? That is going to be the gametocyte. Infective to me is the sporozoid, whereas infective to the mosquito is gametocyte. But have you also heard that malaria can happen via blood transfusion? Yes, not by a mosquito, via blood transfusion. Which is the form? It will directly enter here. Everyone please mark. Malaria will directly enter at this stage. This means at the trophozoid stage. So when it is going from blood or mother to child, it is the trophozoid stage at which the malaria directly enters. So can I say ये वाला पूरा liver वाला cycle is only going to go away? In blood transfusion malaria there is no liver wala cycle, because now I'm going to tell you sometimes this malaria is very lazy. Malaria comes in the liver and says I'm going to sleep off. What is that sleeping form known as? Hypnozoites are going to be the inactive form that is present where? In the liver. So they tend to sleep off, and some later age, after many days or weeks, they will suddenly wake up and then they will result in what? They will result in relapse. But now if I'm talking about a blood transfusion wala malaria, did not have the middle stage. So can you have relapse in blood transfusion malaria? No. And that is what I wanted to know. There is no relapse that you see in malaria with blood transfusion, and that could be a question in your central institute exams. So this was your basics of how malaria is working. So now if I ask you that what are the people who are going to have resistance, immunity against malaria? Which malaria, when it came into my body, it required an antigen called the Duffy antigen. If there is someone who is born without a Duffy antigen, vivax will never ever be able to infect that person. So Duffy negative RBCs are going to be immune. Second, you are saying malaria is attacking the red blood cell. If there is a red blood cell problem, red blood cell का shape का problem, enzyme का problem, या hemoglobin का problem, so you can say that the red blood cell is only not going to survive for 120 days. How will the malaria survive inside it? So basically, in all these situations, the survival of malaria is going to be reduced. That is why these people become immune. Whereas when Duffy is not there, then attachment of Plasmodium vivax cannot occur, and that is the reason again the patient is immune. So what are the features of malaria? The survival of red blood cell का shape का problem, enzyme का problem, या hemoglobin का problem. So you can say that the red blood cell is only not going to survive for 120 days. How will the malaria survive inside it? So basically, in all these situations, the survival of malaria is going to be reduced. That is why these people become immune. Whereas when Duffy is not there, then attachment of Plasmodium vivax cannot occur, and that is the reason again the patient is immune. So what are the features of malaria? Behind malaria, there is going to be a patient with fever and chills. Of course, this is a very simple thing, and after that, this fever is going to come down with a lot of sweats cannot occur, and that is the reason again the patient is immune. So what are the features of malaria? Behind malaria, there is going to be a patient with fever and chills. Of course, this is a very simple thing, and after that, this fever is going to come down with a lot of sweating. ये तो basic पता है. But what is malignant malaria? Malignant malaria means that the patient has cerebral malaria. Guys, I want to ask you from pathology in cerebral malaria, what was the granuloma that you had seen in pathology? Yes, it was a Dirk granuloma correlation. Next, can malaria have black water fever? Fever तो पता था man, what is black water? Hemoglobin urea, possible है. There can be blood breakage, there can be hemolysis. Hemoglobin urea will make it black urine, so black water fever. Renal manifestations. Yes, now we know that malaria has been associated with MGN, membranous glomerulonephropathy, basically nephrotic syndrome के साथ associated. And finally, algid malaria. In this, malaria has been associated with circulatory failure. Malaria associated with circulatory failure, and that is going to be algid malaria. But whatever I'm talking about are those four main: vivax, falciparum, malaria, and ovale. Because now we also have something known as malaria associated with circulatory failure. Malaria associated with the fever. Fever तो पता था man, what is black water? Hemoglobin urea, possible है. There can be blood breakage, there can be hemolysis. Hemoglobin urea will make it black urine, so black water fever. Renal manifestations. Yes, now we know that malaria has been associated with MGN, membranous glomerulonephropathy, basically nephrotic syndrome के साथ associated. And finally, algid malaria. In this, malaria has been associated with circulatory failure. Malaria associated with circulatory failure, and that is going to be algid malaria. But whatever I'm talking about are those four main: vivax, falciparum, malaria, and ovale. Because now we also have something known as malaria knowlesi, or Plasmodium knowlesi, which has basically come up in Malaysia from the monkeys. MNM, it has come up in Malaysia from the monkeys. That is Plasmodium knowlesi. Now, of course, you are going to go ahead with the lab diagnosis, and I've always told you that for the lab diagnosis of malaria, you have to give me maximum attention. That means that the light microscopy is the gold standard. Pathology, microbiology people are going to be the ones who are going to be needed for it. So, we'll start one by one in order of this. We bookmark this slide and we'll keep coming back to it. Let's start from the gold standard, which is the light microscopy. What do? I make a thick smear, and I'm also going to make a thin smear. But what is the purpose of making these two smears? Because the thick smear, I will need more quantity of blood. This is basically for counting, for quantification of malaria. That okay, there are 100, 200, 1000, how many malaria are there? Thick smear will tell me. But if I want to do the species identification, we are going to go in for the thin smear. That is very important. So that is the gold standard. So अच्छा smear बना लिया. How do I stain it? What has been proposed by the malaria program is the Jaswant Singh Bhattacharya stain. It has been proposed that we have to use the Jaswant Singh Bhattacharya stain, also written as JSB. Okay, so now tell me, what is the, if I say you are examining this slide, you say, ma'am, you kept looking at it for 5 minutes, 10 minutes, 20 minutes, kab tak? We were not seeing any malaria. So, kab tak dekho? Till when will you see? Is there any standard protocol? Yes, you have to examine 200 to 300 oil emulsion fields. Under oil, you find malaria. 200 to 300 fields you see. If you still don't find anything, then you will have to pakka nahi. So, what is the sensitivity? Remember, for a thick smear, the sensitivity is 5 parasites per microliter, and thin smear, 200 parasites per microliter. So, I'll write it over here. 5 parasites per microliter and 200 parasites per microliter is the sensitivity. This was the gold standard. But now, what are you seeing? Microscopy में दिखेगा क्या? Slide तो हो गया, but what are you going to see? Firstly, you're going to see some dots and clefts. You don't know the picture of this, you get more of theoretical information. Microscopic examination shows you Vivax made the very, very famous Schaffner's dot. So, how am I going to learn it? Viva me, then you're going to be shuffling. The Viva examiner is never going to ask you chapter wise like I'm teaching. Viva examiner will ask you microscopic micrometer is the sensitivity. This was the gold standard. But now what are you seeing? Microscopy में दिखेगा क्या? Slide तो हो गया, but what are you going to see? Firstly, you're going to see some dots and clefts. You don't know the pictures of this, you get more of theoretical information. Microscopic examination shows you Vivax made the very, very famous Schaffner's dot. So how am I going to learn it? Viva me, then you're going to be shuffling. The Viva examiner is never going to ask you chapter wise like I'm teaching. Viva examiner will ask you anything. Cisco, Primator, Coccidian, कुछ भी. Schaffner's dots. So shuffle होके आएगा Viva में. How we learned it. Falciparum. उल्टा पढ़ो. MAUR जैसा. So what is that going to show you? That is going to show you the moral cleft. Next, Malaria is going to show you Z-man dot. Malaria shows you Z-man dot, and ovale has 5 alphabets, so that is going to show you the James dots. So everyone's learned it. Viva में shuffling. Falciparum is going to be showing you moral clefts. Malaria will show you Z-man dots, and ovale is going to show you the James dots. Now finally tell me, what is the pic James dots? That is going to show you the moral cleft. Next, Malaria is going to show you Z-man dot. Malaria shows you Z-man dot, and ovale has 5 alphabets, so that is going to show you the James dots. So everyone's learned it. Viva में shuffling. Falciparum is going to be showing you moral clefts. Malaria will show you Z-man dots, and ovale is going to show you the James dots. Now finally tell me, what is the pigment that you're going to see? In all of them, there is a pigment of malaria known as the hemoglobin pigment, which all of us definitely have to know. So, ये तो सब theory हो गया. What do you actually see under the microscope? Under the microscope, we always have to look out for T, S, and G. We always see T and G. What is T and G? Again, like I was telling you in the life cycle, it is a trophozoite, it is a schizont, and it is a gametocyte. Trophozoite, schizont, and gametocyte is going to be noted. So, देखिए एक साथ we are mainly concerned in this row, Plasmodium vivax and Plasmodium falciparum. Let us see. So, how does the Plasmodium vivax look like as PSG? So trophozoite, let us start with the trophozoite. This is nothing but a ring form. Trophozoite is nothing but a ring form. How many rings are you seeing over here? And so simple. I am seeing just one ring over here, and inside that one ring I am seeing one dot. I am seeing one ring and I am seeing one dot inside it. How easy? Because I will learn Vivax had the one ring and one dot. It's simple now. Vivax, one ring, one dot. That is an early trophozoite. Now when it becomes late stage ring, it's still a ring. Try to trace it. It is still a ring, but it has become a mota wala ring. So that is why over here, this is known as the amoeboid form. This is known as the amoeboid form. Finally comes T हो गया. Trophozoite is done. TS, schizont. Schizont has these multiple dot things inside it, which are referred to as the merozoites. And finally comes the gametocyte. What is the shape of the gametocyte that you see over here? It is a spherical gametocyte. Macro is known as female, micro is known as male. I've already given you a mnemonic that macro मतलब females को ज़्यादा importance. Female quiz. And finally comes the gametocyte, the amoeboid form. This is known as the amoeboid form. Finally comes T हो गया. Trophozoite is done. TS, schizont. Schizont has these multiple dot things inside it, which are referred to as the merozoites. And finally comes the gametocyte. What is the shape of the gametocyte that you see over here? It is a spherical gametocyte. Macro is known as female, micro is known as male. I've already given you a mnemonic that macro मतलब females को ज़्यादा importance. Females have to be given more importance. So now tell me, how will I differentiate both of them as spherical? The one which has, can you see there is a chromatin? कहाँ present है? The chromatin is going to be seen at the periphery. Whereas इसमें the chromatin is seen at the center. That is how you differentiate male versus female. So remember, if the chromatin is going to be eccentric, that is a female gametocyte. And if the chromatin is going to be central, that is going to be a male gametocyte. This is how you identify different Vivax species. Because now I will tell you the classification and the identification of Plasmodium falciparum. But I don't see too many pictures. All that I see is a trophozoite and a gametocyte. Man, TSG देखना था. Trophozoite and gametocyte species. Because now I will tell you.
Hi everyone. So that was it for the study session. I hope you people also did studied well. And now I'm late if I do not get ready for hospital now. And bye. See you in the next study session. I hope it was productive, and I will try to be more consistent from now on. And bye. See you and take care.